Welcome back to Your Carolina. I hope you never have to know the full effects of breast cancer and what it puts a body through. In fact, most people don't know. We have no idea unless we have a close family member or ourselves who have been through it. We've sent out Jessica Drew to actually talk with some of the ladies who are going through it and to give you a better idea what they struggle with. I have to warn you, some of these pictures are graphic.
Welcome back to Your Carolina. I'm Jessica Drew, and I'm joined here with Dr. John Lettieri of Carolina Plastic Surgery. Thank you so much for joining us, Dr. Lettieri.
Thank you, Jessica.
Now, October is Breast Cancer Awareness Month, and you have some very important information to share with our viewers. Tell us a little bit about early detection.
Well, that's a key, Jessica, as has been promoted for many decades now. Women do best who have breast cancer if it's detected early. So self-breast exams, having regular mammograms are a key part of doing well if they eventually get breast cancer. Women who have implants should have mammograms when they would otherwise be scheduled for mammograms. It won't hurt the implant, it's not going to be more painful for them, and it's very important.
And for women who do have implants, are they the only ones that can have breast reconstructive surgery?
No. Women who have breast cancer, of course, have a myriad of options for treatment. Some of them increasingly don't have their breast removed. So the reconstruction they would possibly need, if any, would be different. Those who have their breast removed often have reconstruction, and implants are the most common method for reconstruction. But then there's an entire separate group of women who have a high risk for breast cancer, maybe a strong family history, or they're genetically positive and have been tested for such, and therefore their risk of breast cancer in their lifetime is extremely high. So for those women, we are increasingly performing preventive mastectomies, a more limited mastectomy, one that can be reconstructed very quickly, often starting at the same time as the breast removal. So that's another very important category of women who virtually all want reconstruction because they're having their breast removed for preventive reasons, and of course want to maintain a youthful, pleasant appearance and natural breast tissue appearance as well.
And for some women who maybe have had their implants or their reconstructive surgery done years and years and years ago, are they still eligible to have more work done and to reconstruct the breast?
Yeah, that's a very good question and an important category of women, Jessica, because breast reconstruction has been performed for 30 or more years, and the quality of that surgery obviously doesn't maintain with time. So there are many women who have been cured of their breast cancer, they had reconstruction, but they need some type of revision. Often if they've had implants, those implants are old, maybe they're ruptured, their breasts have aged, and we can help them a lot by addressing some of these needs, even though it may have been 10, 20, or 30 years since they've had their first reconstruction.
So basically there's a mass amount of women who are available and eligible for breast reconstructive surgery.
Right. So these are women who've had cancer. Some of these women need prevention of breast cancer. And then there's another group that have just had old silicone implants, and those old silicone implants may have been used for just augmentation years ago, maybe for reconstruction, but they're likely ruptured. You know, silicone implants from the 70s and 80s, even early 90s, generally need to be replaced now. So we're seeing an increasingly large number of women who have wondered for many years, unfortunately, should I do anything about this? Can I do anything about this? And yes, there are great choices for those women.
For women that are thinking about getting breast reconstructive surgery during their treatment, do they have to make that decision right away?
Yeah, another great question. So you can imagine that a woman being given the diagnosis of breast cancer is shocked. They're shocked, they're bewildered. The choices increasingly are great, which is good, but on the other hand, it's tough to make a decision when faced with all these choices. Reconstruction is, of course, one of the important choices. So fortunately, there are some surgeries that can be initiated at the time of mastectomy, and for some women, that's a good idea. For other women, it's not such a good idea, and the reasons for that are many. But the message for women is they don't have to decide on reconstruction before they have their cancer surgery. And some women just feel better about that because too many choices. I don't want to make too many decisions that I don't have to make. I want to get the cancer cured. Of course, that's the first priority. And for some women, they would feel better to wait. And for some women, medically, it's better to wait. So it's perfectly fine for them to wait.
So you can cater to each individual patient.
Yeah, very important. That's probably the key word. We really have to customize what we do, not just for the cancer treatment, but for the reconstruction to each individual woman.
Thank you so much. I appreciate it.
Thank you.
Well, thank you so much, and it is nice to see that there are some options and some different options. In fact, if you're wondering if this is for you, then you might want to check this out. It's a free educational seminar, and you'll see before and after photos. There will also be some light refreshments and some door prizes, and you can ask all kinds of questions. Of course, it's presented by Dr. John Lettieri, board-certified plastic surgeon. He can certainly answer those. October 18th, 6:30 p.m., Village of Pelham is where that is. You can also find him at drlettieri.com.